This is Barry Belosis, one of the musculoskeletal radiology fellows at Stanford University. 18-year-old male football player presents for evaluation on the sideline after injury on his left knee. Concern for lateral collateral ligament injury and posterolateral corner injury. The patient in this case presented with this knee radiograph. Here on our AP radiograph, we can see a non-displaced fracture of the fibular head seen here, and also seen on this image right here. Stress views are sometimes done to evaluate for asymmetric widening of the knee joint. The patient in this case underwent Varus stress test demonstrating this asymmetric widening in the lateral compartment, as we can see here, compared to the contralateral side. However, Varus stress testing is not part of the routine workup in patients with knee injury in the emergency setting. The patient also underwent MRI knee without contrast. Here on our coronal T1 imaging, we can see just some hypointensity along the expected course of the fibular collateral ligament. And on our axial PD fat set imaging, we can see this edema just superficial to the fibular collateral ligament and also likely deep to the fibrous right here, which is suggestive of underlying sprain. Additionally, we can see this edema just at the posterolateral corner, concerning for underlying posterolateral corner injury. Here on our sagittal T2 fat sat and PD imaging, we can see that there is bone contusion in the medial femoral condyle and medial tibial plateaus we see here. On our sagittal PD, here we could not see any discrete fracture line. On our coronal T2 fat sat imaging, again we can see this bone contusion in the medial femoral condyle and the tibial plateau, and some sprain injury to the fibular collateral ligament, which would have been expected in this region. This is in a different patient. Here, a quick review of our normal medial collateral ligament. We can see a dark band arising from the distal femur to the tibia without any irregularity. This is in comparison to this partial tear of the MCL on the other patient. We can see this irregular proximal medial collateral ligament. In our fluid sensitive images, we can see that there's edema superficial, deep, and within the fibers itself, consistent with grade 2 sprain. Grade 1 sprain would demonstrate abnormal signal, just superficial to the ligament itself. Again, this is in a different patient. Here on our coronal T2 fat sat imaging, we can see that there is indistinct and not visualized lateral collateral ligament at the femoral attachment right here. On our T1 imaging, we can see that there is no longer hypointense band at the expected location of the fibular collateral ligament. These findings are consistent with grade 3 sprain or a high-grade sprain.